This is a interesting case that had to be addressed surgically due to a complication performed by a different provider. Unfortunately, it required a revision. I'm not sure why this individual underwent a medial column, which is the inner side of the arch fusion. As we can see, there is broken hardware. Apparently the doctor went back in and removed some plates, and some screws were broken, which is typical because of motion, lack of fusion, and so that's what happens. The screws start to break. There is nothing fused, unfortunately, as we can look at all the structures as the images will reveal. So as we look at these different images, in regards to zooming in, if I may, clearly we can see the joint spaces are evident and not fused. So we look at it from this angle clearly as well. So with my cursor, if I may, as we can see, there is a big gap and the hardware is broken along this side. So again, from this angle, when we look at it, it's of concern to me as a doctor and a surgeon in the foot and the ankle. I clearly can see the change in color of these bones, fairly whitish, which would signify avascular necrosis. The bone is basically dead in comparison to its neighbors, as we can see, fairly well defined, and the cancellous, which is the marrow, is healthier. So compare again the colors, which is very, very white in comparison to the darker shades, which is what marrow should look like. So this individual was consented for a revision of the instep to be fused and addressed surgically, and the patient agreed to it. Unfortunately, of note, this individual further approached the provider, and the provider injected her with serial injections called alcohol injections, which is basically acid, weekly injections to kill the pain by killing the nerves rather than addressing the problem, which is very unfortunate. So when I show you the after effect, if I may, I'm going to move this over. And this is upon completion. So when you're looking at this x-ray, now we can clearly see the intensity. Now, first off, you guys are going to be asking, why is the hardware still there? Very, very good point. First off, this is useless. This little guy has been broken. To go after him is going to create more damage to the remaining bone. But when you guys look at it carefully, you guys can see the line, which is right here. All that had to be grounded down all the way, and packed with bone. So that's a huge, huge area to be addressed. I left this screw in since it was providing adequate fixation for this condition. For me to apply another device, there's not much bone structure without damaging the ball in the socket. This is an essential joint. And as we can see, look at the intensity or the close proximity of cleaning up this dead bone, all the way very close to the joint. And so therefore I opted to leave that screw, which was doing me a service. The other screw was on the second metatarsal cuneiform, which was of minimal concern to me and was not needed to be addressed. So in actuality, this is several weeks out. She did get a bone stimulator as well as an ice compression machine. She did require immobilization, and that's what typically happens. It fills in very, very nicely, and it will continue to do so. So as we look at it from a different angle, if I may, from a top to bottom view. Now let's look at this carefully. As we can see, all these structures are now one single unit, right? And obviously you'll have a little bit of slight gapping on top, the dorsal aspect, because there is no compression on the upper area, but overall it is very, very impressive, as we can clearly see. So it's consolidated very, very well and doing very, very well. This is an enlarged, magnified view of the structure. So that is what we need, and also the joint of the ball in the socket is unharmed above all. So this is unfortunate, but it is much, much better than before, and I think she will have a better functional foot. In regards to now, there is bone on bone rather than pseudoarthrosis or non-arthrodesis fused sites that is going to help the patient tremendously. So, as we look at it from a different angle as well, the condition continues to show that it's consolidated. And so that is, in a nutshell, a nice case study in comparison to, as you guys remember, which was this, and I will try to magnify it so you guys can see it. This was before surgery, and as you can see, all the joints. And it's very unfortunate when you're looking at it from this angle as well. All that is not fused, and therefore that's why the screw broke, and then removal of the hardware, more likely because the hardware possibly was sticking out because of pistoning and motion because of the lack of fusion. So otherwise, this was a nice, interesting case. And so trying to educate the public, when you do look at the x-rays, please be proactive, not just looking at the shine, which is the metal. Look at what was told and what is done, and compare before and after, making sure you have a total understanding before and then after the procedure. And so therefore you should be very versed and knowledgeable of, to some extent, what you're undergoing. Thank you again.